Bismillahirrahmanirrahim. Assalamu alaikum viewers. Today we'll discuss about the teaching and learning theories and models. This session is continuation of the last session in which we had discussed about the basics basic concept about teaching and learning, and later we had discussed the three theories: the behavioral theories, the cognitive theories, and the other. Uh, First of all, thank you for subscribing Theoretical Nursing and for sending your comments and feedback. Uh, so in this session, again, we will review the basic three teaching and learning theories that we had discussed in the last session, because many of the students had sent feedbacks and text messages that kindly explain the last session theories with the relevant example again. So I'm just reviewing the basic concept of this three theory again. Okay, now first of all, learning, as we had discussed, that it is uh, a relatively permanent change in the mental processing, emotional functioning, and behavior as a result of the past experience. It is the lifelong dynamic process by which individuals acquire new knowledge and skills and alter their thoughts, feeling, attitudes, and action. And about the learning theories, it is defined as a coherent framework and a set of integrated constructs and principles. They describe, explain, and or predict how people learn. So the basic idea and essence of this slide is that learning is a process that is dynamic in nature, and actually when the piece of information may change your behavior and action, or either acquisition of the new skills. We are, as part of the learning theories, we had discussed that it is acting like a map. So now we'll discuss and review the basic concept of the first theory, that is called the behaviorist learning theories. And we will explain this theory with example, like uh, consider an example from the healthcare, like someone without much experience with hospital, the visitor who did not visiting for the first time to the hospital. So that hospital is the neutral stimulus, as we had discussed in the behavioral learning theories, that neutral stimulus is those that they had no effect with the stimulus or the response. So the person who visiting for the first time to the hospital, uh, that is called the neutral stimulus, may visit their sick relative there. So while in the relative rooms, the visitor may smell offensive odors in the hospital. That is usually common in the hospitals. So that offensive odor is known as unconditional stimulus for that newcomers to the hospital, and feel queasy and lightheaded. So that reaction, this due to that offensive odor, is called the unconditional response. So in this example, we had discussed that the hospital is the neutral stimulus, whereas the offensive order, bad order, is the unconditional stimulus that is exist everywhere. Uh, and the feeling queasy and lightheadedness is the unconditional response to that unconditional stimulus. So after this initial visit, and later when this person repeatedly visit to the hospital, so he might have the same experience again and again when he or she visiting to the hospital. So visiting to the hospital again is called a conditional stimulus that is related to the hospital, may become associated with the feeling of anxiety, nauseatic feeling. So that conscious conditional stimulus is again producing the conditioned response, especially if the visitor smells odor are similar to those odor somewhere outside the hustle. So that uh, conditional stimulus produce the conditional response. So that was the basic essence of the behaviorist theories, that the neutral stimulus, the unconditional stimulus, and then the unconditional response, the conditional stimulus, and then the conditional response were the basic theme of the um, behaviorist theories. And here we had a picture that will explain the behaviorist theory concept, like the conditional stimulus, as we had discussed, will produce the unconditional response, and the neutral stimulus, that is the hospital, plus the unconditional stimulus like the offensive order, will produce the unconditional response like feeling nauseatic and lightheadedness. So again, if this guy or person is visiting again and again, or repeated visiting to the hospital, like several pairing of these neutral stimulus and unconditional response, so again he will produce the same, that stimulus will then convert it to conditional stimulus and conditional response. So I will explain with diagram again, like the offensive order known as called in the hospital is called unconditional stimulus, where the queasy feeling is called the unconditional response. Whereas the hospital is the neutral stimulus plus the offensive order is unconditional stimulus to that person who is visiting for the first time to the hospital, and the queasy feeling or the lightheadedness is the unconditional response, that whenever he or she visit to the hospital, so he will feel the same queasy feeling and lightheadedness. So again, where several pairing of the hospital plus offensive order like the neutral stimulus plus offensive order will again receive the same receive the same response of queasy feeling and lightheadedness. So the hospital is basically the conditional stimulus, and the queasy feeling is the conditional response. So that was the main essence of that behaviorist theories. So now, if there is the conditional stimulus with the conditional response, so how we have to treat? So the psychologist usually treat these patients by systemic desensitization therapy. Like example, like fear anxiety therapy, in which we have learned that the systemic desensitization is a therapy in which a technique is based on the responding conditioning that is used by psychologists to reduce fear and anxiety in their clients. The assumption is that fear of a particular stimulus or a situation is learned, so it can therefore be unlearned and extinguished. So it is concluded that the assumption is the fear of a particular stimulus, like queasy feeling, the stimulus, and then the situation is learned, where the conditional stimulus with the conditional response, here they are talking about, so it can therefore be unlearned and extinguished. So the other example we can also elaborated this in the healthcare setting. Systemic desensitization has been used to treat drug addiction. We can use drug addiction by this therapy, phobias, and tension headaches. These are the uh, condition that can be treated by systemic desensitization. Systemic desensitization is a therapy in which the psychologist or the therapist um, expose the person or the client to those stimulus in which the client is producing that conditional response. So that conditional stimulus lead to that conditional response. So now the therapist is using that technique, systemic desensitization, by exposing the client to that conditional stimulus. So the time is reached when that conditional response is unlearned and extinguished, finished by this therapy. So that was the basic essence of the behavior therapy, in which the client then learn that how to cope up with the therapy. So basically it's a concept or perspective of the behaviorist that learning can happen through stimulus and response mechanism. Another concept was we had discussed about the cognitive learning theories, because the behaviorist theory generally ignore the internal dynamic of the learning. It was mostly focused on the stimulus and the response. They were the external aspect they were talking. So the need of the cognitive learning theory was arised, where they have said that the behavioral theory generally they have ignored the internal dynamic of the learning, like cognition means the mental processes, thought, thinking, perceptions. So cognitive learning theorists stress the importance of what goes on inside the learner brain. So that thought process is also necessary and for learning to take place. So that the key to learning and changing is the individual cognition. Cognition mean, as I have discussed, perception, thought, memory, and ways of processing or structuring the information. So according to this perspective, the cognitive theory, to learn, individual must change their cognition, like as the teacher teaching to the students, faculty teaching to the students, so they are giving information, and that information is used, utilized by the audience, because their information change their cognition level. The student or the audience are compelled to think about the concept, um, and that they had received from their faculty members. So the example of this theory is patient in severe pain are worried about their hospital bill may not attend to well-intended patient education information, like cognition or attention is very much important while learning the concept. So learning is basically take place when your cognition, your thought process is involved in that. Like the patient in a hospital thinking about the hospital bill, or he or she is in severe pain. So, and at that time when a nurse is teaching to that about certain disease or anything else, so that patient will not grasp or understand that information. The basic criticism on the cognitive theory was that for neglecting the social aspect, as we had discussed, that the behaviorist ignore the internal aspect, like the cognition aspect. So here the cognitive theories ignore the social aspect. So the effect of social factor like also influence learning, like the perception of individual thought process, motivation, and getting the attention is also are also related factor that affect the learning processes. So these were the criticism on the cognitive theories. So after that, another concept, another perspective was arised by Albert Bandura, that is called social learning theory. So according to the social learning theories, they are mostly focusing on the social aspect that they had ignored by the cognitive theories. So much of the learning occurs by observation, watching other people, discerning what happened to them, or learning is often a social process, interaction and with other individuals, especially the significant other, like the personalities models provide compelling example, like a role model for how to think or feel about and act about it. So basically these the concept of social learning theory is much about focus on the social interaction and role modeling. Role modeling is basically a personality in which the people, the public are inspired from it. So people are acquiring their habits and their actions by following that person. So basically, the social learning theory is focusing on that principle. Role modeling is basically a central concept of the social learning theories, and we will explain this by example, like a more experienced nurse in the unit who demonstrate desirable professional attitude and behavior by coming to the unit on time and living by time. The skills, their demonstration of attitude, communication style, so that skills that the senior nurse had will expire the junior nurse, and that senior nurse will act as a mentor for the less experienced nurses. Similarly, the medical student are enter their and resident are mentored by the attending physician, and these junior doctor are much more impressed by their senior physician. So these are basically the role modeling where the person is learning from their um, basic the like one the individual or the person in which he or she is working with. The benefit of this theory is in the healthcare. The social learning theory has been applied to staff training and to intervention that address public health problems such as teenage smoking, alcoholism among the elderly people. So now Today we have discussed about the basic concept of the first three. We have reviewed this concept with the relevant examples. So, in the next session, we will discuss about the last two theories, and then we will compare that why we are studying these different theories and different perspective of the theorist about the learning process. Thank you so much for your kind listening.